Hello, everyone. Welcome. I am a few minutes late, and you know what? In all transparency, I had forgotten to take my ADHD meds. And so here's your reminder if you have also forgotten to do so whenever you're watching this video, take your meds. But that I made sure that happened beforehand. All right. So, hi. I'm Dr. Maelisa McCaffrey, and today we are talking about writing client progress letters. So, we're going to talk about a variety of letters. If you have ever had a client ask you to write a letter for them, we're going to talk about all the different types of letters you might be asked to write, whether or not you should write them, whether or not you can write them, and when you do write one, what to put in them and what to think about. So you are welcome, if you are here live, to go ahead and let me know in the chat you can hear me okay, but also to ask questions, and I will follow up while we're talking. So we have quite a few things to cover. But just in case you don't know me, I'm Dr. Maelisa McCaffrey, of QAPrep.com and author of the upcoming book, Stress-Free Documentation, where, yes, we will be talking about letters in that book as well. So here is a little sneak peek. All right, let's start off with letters. Do you have to write them? No. So you do not have to write letters. This is if you are in private practice and you are making your own decisions about your practice. You can have a policy that you don't write letters. There's nothing that says you have to write letters, as far as I know, in all states. Do you have to give clients access to their records? Yes. Do you have to summarize that by taking time out of your schedule to write a specific letter summarizing that? No. Do most clinicians do it? Yes. So most of us see the benefit of when clients have a need for their records to be produced in some way, if there's a chance that we can offer a quick summary letter instead of having someone's full details, full record, all their progress notes for all sessions released. Usually having that quick summary letter serves whatever purpose they are trying to meet, but also protects their information and doesn't lay out, all of the details that might be in a variety of progress notes. So while it is not wrong to release records, and in fact, it is legal to do so when people ask, often writing a letter better serves that need. And so letting people know that can be really helpful. That said, you don't have to, but you need to outline this in your policies, in your practice policies, and as part of your consent documents. So whenever you have clients sign at the beginning, I do recommend that you outline whether or not you do write letters for people. You don't have to go into the details of all of the letters, but I do recommend that you say whether or not you write them. And to our next point, how much you might charge for writing a letter. So this is a little bit different from, again, records release. So people have a right to access their records. Typically, you can't tell someone, no, you can't have your records, right? And within that, it's also typically illegal for you to charge them an exorbitant fee for access to their records. So most states actually outline specifically how much you can charge someone for copies of their records. Now, not usually, but often you don't even need to do this. You can just give people an electronic copy securely. But if they want paper records, you are allowed to charge them for the printing costs. And like I said, usually your state will give you specific guidelines, like literally on how many cents per page you're allowed to charge people. A letter is different because people are not typically inherently entitled to you producing a summary letter. That's different from the records, right? So you can charge for writing a letter. Again, this is where there's a bit of a gray area as far as what to charge. Let's say you don't want people to ask you for letters, but you want to offer it just in case, and your hourly rate is $150 an hour. It would be pretty unreasonable to expect someone to pay $1,000 for you to write a quick summary letter of treatment. So I usually recommend whatever your hourly rate is, that's what you charge for writing a letter. It typically takes anywhere from 30 to 60 minutes for most of us to write a letter, especially based on the outline criteria I'm going to give you today. So it shouldn't take a huge amount of time, but it does take time out of your schedule to do this. And then typically, if someone's asking you for a letter, then there are all kinds of other things with that too that might be taking up your time. So I do recommend that you offer letters to clients because it can be really a way for them to protect their information, but still meet a potential need and charge for it because it is time out of your schedule that is outside of regular session time, and you deserve to be paid for that. But again, outline this in your policies. Make sure your policy identifies whether or not you write letters, and if you do write letters, how much you charge. So those would be my big things. Next, you can even choose which letters you want to write. So you might outline that you do not write letters for child custody cases. So let's say you're a therapist who sees children. It is pretty common that you might see children who either have divorced parents or whose parents are in the middle of a divorce. And in either of those cases, potentially you have custody issues come up. And that's where one parent can try to pit the other against one another, or the child against a parent, etc. Right? It gets very messy. And often people unfortunately, will try to use therapy as a tool in that process in a very unfair way. And therapists often have really good intentions throughout this process because you see this child hurting and you might have an affinity for one parent over another. But be very careful in these situations because they get very tricky easily. And your loyalty, for lack of a better word, is always to the client and not to either parent. Okay. And that means you need to remain objective. And we're going to talk about that when we talk about what to put in letters. All that to say, you could choose to say that you do not write letters for child custody cases. So in most scenarios, most of us, if you're a therapist in private practice, in any state, province, whatever, most of the time when you're asked for a letter, the purpose is more about summary or progress. So summarizing treatment or summarizing progress of treatment up until now. When people ask you for a specific type of letter because they have a specific reason and they want you to make some type of recommendation related to that letter, that often requires a different type of relationship with that client. And that's based on our ethical principles. So most of our ethical guidelines do speak to this. For example, if you are a child custody evaluator, that is a very different role than being a child's therapist. So the child custody evaluator actually is hired to provide an opinion and make a recommendation. And they are writing actually a whole report, not just a summary letter, but they're writing a whole report with that purpose in mind. That's very different from being the child's therapist, where potentially a letter might actually be to one of those child custody evaluators. And your letter would just be a summary of progress or a summary of the treatment and not making a recommendation. So let's dig into what are these different types of letters. So you might be asked for letters related to child custody. You might be asked for letters related to drug or alcohol use. You might be asked for letters related to court-appointed therapy, so reporting on attendance. You might be asked for letters from attorneys making recommendations. And attorneys will do this both unknowingly and knowingly, meaning an attorney may know it is not actually ethical or best practice for you as a therapist to make a recommendation in a case. They will still ask you for it. And sometimes that's because they don't know any better and they genuinely just want your recommendation and and they're looking for an expert opinion on something. And sometimes it's knowingly trying to get your expert opinion at a much cheaper rate or potentially even for free. And trying to, because you're more easily accessible, they already know you because you're the client's therapist, rather than having to go through the routes that they're typically supposed to take of getting a separate expert opinion. So do know that this does happen. And it's not always malicious, and sometimes it is a little manipulative. So those are cases where you would want to make sure that the relationship is very well established and related to the purpose of writing the letter. The other more common scenario is a report of progress or a summary letter. And that is a letter that a lot of us write all the time, or in very different, or in a variety of scenarios. And that's the most common letter in a private practice setting, or even if you work in like an agency, that you will be most likely to write, and that's most likely to be requested. So, regardless of the type of letter this is, as soon as you receive this request, we're going to talk about what do you do when you get the request, and then what do you put in the letter. As soon as you receive this request, you want to talk with the client. That should always be your first step, is discussing with them, what is your policy? So is your policy, sure, I can offer you a letter. Here's how much I charge. Or sure, I can actually, no, I don't write letters for that purpose. Or I can't give you a letter with a recommendation because I'm your therapist, but I can give you a summary letter, right? So depending on whatever they're requesting, it's informing the client of what you can and can't do and what will be expected. After that, if it is a contentious case, so even if you have that discussion, but if anytime you're feeling uneasy, I would say this is where I always say trust your gut. You likely and should have liability insurance. So especially if you're here in the US, I would recommend it. It's pretty affordable, actually. Do it. It's worth it. If you have liability insurance, this is something we often don't think about. We only think about using them for like a horrible, like worst case scenario. No, you can call them up and they have attorneys that you can talk to. So if you're feeling uncomfortable about a request you received, or if you're unsure whether or not it would be appropriate to write a letter in a certain circumstance, call up your liability insurance or your malpractice insurance and ask them, um, you know, for a consult with an attorney. You typically get so many of those with whatever insurance policy you have. So make use of it. Make use of it. Um, and if you have an ongoing relationship with an attorney, of course, you can talk with one of them. Or if you have colleagues, you can always consult with them as well, especially if you're part of a group or something. But yeah, don't forget about your malpractice insurance or liability insurance. Then, regardless of whether or not, it's a minor thing or a big deal, review the record. So go through and look through your notes, look through the treatment plan, look through the initial assessment you did with the client, and make sure that the diagnosis that you have listed in the record still seems accurate today. Just review the record so you're familiar with it. Again, this does not have to be a super long process. And you're not, this is for creating a letter. So this is not the same as releasing records. So it doesn't mean you need to go through everything with a fine tooth comb and make sure it's all super accurate, but it is a good idea if someone is requesting a letter. Typically outside entities are involved in some way. So you want to familiarize yourself with things and kind of make sure, things are up to par there. So do that and then make a note about the request in your own documentation. So in the client's record, you want to make a note when they request the letter, and make these very short and fact-based. So literally one sentence. Client requested a progress letter for their upcoming psychiatrist appointment. It could be that simple, right? That easy. Make a note about the request, and then make a note about when you write the letter, how much time that took, because if you are billing, you want to document anything related to billing. So even if you wouldn't bill this to an insurance company, sidebar, that's another thing you'd want to include in your consent documents. So if someone is seeing you and you are billing to their insurance company, let them know this is a separate fee. So make a note about that in your documents. And then when you actually give the client the letter, or if they've asked you to just give it to somebody else when you send it to that person, document, that you have a release of information on file and that you sent the letter to whomever on whatever date. So keep it really basic, but request was made, you wrote the letter and charged for it, you sent it off, and to whom. Those would be the big things to consider there. All right, I'm just going to double check. We have no questions. Awesome. Let me just have a nice hello. All right. So, our last thing that we're going to cover is what do you put in this letter? So, if you are writing a summary letter, um, the first thing before I get into specifics is to remember what I just said about being objective. Think about like the old dragnet thing, just the facts, ma'am, just the facts. So, anytime you're writing a letter, again, unless it is specifically for a purpose that you were hired to make a recommendation, which is usually the type of thing you would have had to get special training for, and you wouldn't be watching this video related to that. But for progress or summary letters, you are not making a recommendation, you are simply stating facts. So that is what we are going to do. We are not going to interpret anything. All we are going to do is state basic facts. So things like your information and your role, so your name, your title, and the fact that you are, the child's therapist, or the person's therapist, or the couple's therapist, whatever your role is. The dates of treatment. So literally, they began seeing me on this day and continue until the present day, or they began seeing me on this day and ended treatment on this date. The reason for treatment. So they initially sought treatment for, and it could be adjustment after divorce. It could be having difficulty in school. It could be communication troubles. So you can keep it very basic, kind of vague, but still specific enough so that it's not just sought therapy. Look at the actual reason for treatment. If there is a diagnosis, if you gave a diagnosis, you can list the diagnosis, client's diagnosis is. You could also list symptoms or problems related to the diagnosis, but again, make that very, very fact-based. So nothing that is interpreted, or nothing that is unseen. So this is where you want to keep things in very behavioral terms so that it is not later misinterpreted in some way. It should be very, very fact-based. List any treatment goals you had with the client. So what were the treatment goals either that you accomplished or were working on if it's a former client, or what are the treatment goals you continue to work on if you're still seeing this client? And then list if there was any progress toward those goals. And literally you can make, client has made significant progress towards meeting their goals. Client has made some progress towards meeting their goals. So keep it very basic. If it's a former client, client was not able to meet goal before therapy ended. So again, that is more of a fact-based statement than adding an interpretation like client was unmotivated for therapy and therefore never worked on meeting their goals. That's the type of statement we want to avoid in a letter that we are then giving out to the public in some way. We want to keep it very fact-based. They were unable to meet their goals before therapy ended. That is not, that is up less for interpretation. It's simply a fact. And then why therapy ended, if that applies. So if this is for a former client, you want to list out, the fact that maybe, so a fact would be if someone continued to no-show, you could say something like client did not attend last 3 appointments. And so therapist provided referrals and referred client to another provider per policy, something like that. Again, keeping it very fact-based. If clients no-show, that is a fact. And that is sometimes the reason treatment ends. And it is okay to reflect that. So again, this letter is not about you making someone look good or bad. That is the thing that you really want to avoid whenever you're writing a summary or a progress letter. It's not about making someone look good or bad, because unfortunately, no matter what you write and might think about that, oftentimes your intentions can still be manipulated in other ways. And so it is best to just keep things really simple and basic. So that at least the points that you are making cannot be argued. Because if you did add in a statement about, client was unmotivated, that's something that could be argued by the client, could be argued by a family member of that client. It could be, circumstances that you honestly weren't even aware of in the moment. And so maybe it didn't have to do with motivation, but it had to do with something the client wasn't telling you about, right? So there are a variety of reasons, to use this example, that a client might discontinue coming to therapy, none of which mean they're unmotivated. So we wouldn't want to make a statement like that. We would just say that they stopped coming to sessions. And I really want to highlight here at the end, and if anyone who is here live has a question, this would be the time to type that in the chat before we finish up. But I want to leave you with, do not include an opinion or a recommendation of any kind unless you are specifically hired and being paid to do that for that reason. So if you're a child custody evaluator, that's what you were hired to do, to make a recommendation on child custody. If you are a child's ongoing therapist, you are not hired to make a recommendation about custody. You are hired to help that child through whatever problem it is they're going through in their life. And that is your focus. So that's what you would write that letter about. I keep using that example because it's one that comes up where therapists, again, are very well-meaning and wanting to influence a situation. But it is really not the time to try and insert yourself in that way because one, it's unethical for most of us in most situations to do that. And two, it can go sideways in ways you're not imagining. So there's a reason that those ethics guidelines are in place. Our role is to serve for our clients, and we are subjective about our clients. Often we do have certain feelings about our clients because we're relational beings, and we all know that the relationship within therapy is what makes therapy so valuable. And so we're not meant to be, this might be controversial, but we're not meant to be a total blank slate objective person about our clients. We are meant to actually have personal interactions with them and a professional relationship, or a relationship nonetheless. So with that in mind, we don't write the most objective things. And so this can be a difficult process. But just to review, remember, you're going to include your information in your role, dates of treatment, the reason for treatment in like one sentence and one basic problem, diagnosis or symptoms, goals of the therapy, what was the progress, and literally some progress was made. Client was able to make some progress toward goals. Client was able to meet goals. Client was not able to meet goals before therapy ended. And then why the therapy ended if it did. All right. So that's everything I have for you in a nutshell on writing client summary and progress letters. Hopefully this helps you if you are, for when you receive those requests. And if at the top of this video, when you heard me talking about your policies and you thought, I don't have that in my policies, that is your next task. So I would recommend, do decide if you want to write letters for clients. Most of us do. It makes sense, again, for protecting confidentiality and encouraging clients to request letters rather than full records, and determine how much you want to charge for that. Those are really the two big things to decide, and then put that in your current informed consent documents or consent for services documents. Add that there. All right. Thank you, everyone, for being here. It was awesome to see you all. And we will be back next week with a different exciting series. All right. Till then, happy writing.